system's rigged, man, it's time to break free. Eyes wide open, gotta see what I see. Standing on the front lines, fighting for the truth. Lift the veil of lies, it's time to be the proof. Take a stand, don't you back down. Raise your voice, let's shake the town. We're the voices that won't be ignored. Breaking chains, yeah, we're ready for war. With the power of the people, we'll make them see a world of justice, united and free. United and free.
Okay, good morning.
Good morning, Your Honor.
We're here in the state of Ohio versus Toby Madden, CR 22-121675. The jurors are not present. Mr. Burris and Mr. Hahn and Detective Horton are present on behalf of the state. The defendant appears in person with counsel, Mr. Wilder. Before we bring in the jury, is there anything on behalf of the state of Ohio?
Just for scheduling purposes, I was going to have 3 witnesses here this morning to fill up the morning. One of them had an issue that came up, so he will be here first thing tomorrow morning. So I anticipate the Dr. Updegrove will testify today, Detective Doug Tran will testify today. I think they're probably still going to take up the majority of the morning. Then I will have 2 or 3 witnesses tomorrow, so we anticipate resting before the noon hour tomorrow night.
Okay, thank you for updating us on the schedule.
Yes, Your Honor, thank you.
Anything on behalf of you, your client, Mr. Wilder?
Not at this moment, thank you.
Okay, let's go ahead and bring in the jurors. Please be seated. Good morning, ladies and gentlemen. Does anyone have any violations of the court's recess instructions that they need to report? Okay. All right, Mr. Burris, you may call your next witness. Thank you. Or Mr. Hahn, thank you.
Yes. Statement called Dr. Rachelle Brewsaugh.
You may proceed.
Thank you. Good morning.
Good morning.
Can you tell everyone your name and spell your last name, please?
Russell Updegrove. Last name's Uptegrove.
All right. And how are you currently employed, sir?
I'm a forensic pathologist at the Hamilton County Coroner's Office in Blue Ash.
Okay. And do you provide services to any other counties besides Hamilton County?
Well, I mean, in my position in Hamilton County, we perform autopsies for some other counties, although Butler County is not one of those. However, historically, probably for about 19 years now, I've been sort of the backup pathologist here. Back when Dr. Swinehart was a pathologist, when he'd go out of town, I would fill in, and now that Dr. Utz is the primary pathologist, I will fill in Butler County whenever he's out of town.
Okay, all right. And so you said you've been doing that, filling in Butler County for 19 years, is that
Yes.
correct? Okay. And have you ever worked in Warren County?
I'm actually the Warren County elected coroner.
Okay, and how long have you been in that position?
I was elected in 2007.
All right. And could you please explain to the jury what is forensic pathology?
Well, forensic pathology entails doing autopsies on individuals, typically for non-natural circumstances. I mean, people that are in the hospital and may die of cancer or complications from stroke and heart disease, emphysema, things of that nature, typically aren't reported to a coroner's office. So from forensic pathology perspective, we're doing autopsies on people that are dying suddenly and unexpectedly without any significant medical history, people who have some sort of trauma, whether it be from a motor vehicle crash or a fall, and obviously things that may involve criminal activity, gunshot wounds, blunt force injury, stab wounds, things of that nature.
Okay. And you just describe to the jury what your educational background is and educational experience as it relates to forensic pathology?
Yeah, I graduated from Clemson University in South Carolina and with my undergraduate degree, and then I attended and graduated from the Medical University of South Carolina in Charleston, South Carolina. Because of my interest in forensic pathology, I completed a residency in anatomic and clinical pathology at the Medical University in Charleston, and also completed a forensic pathology fellowship at the Charleston County Medical Examiner's Office. And then after completion of my training, I relocated to Ohio in July of 1999 and started working as a forensic pathologist at the Montgomery County Coroner's Office, which is in Dayton.
Okay. So how long in total would you say you've been a forensic pathologist?
Well, since July of 1999, when I began working full-time in Dayton.
Okay. And if you know, how many autopsies do you think you've performed in your career?
Well, it might be 50 or 75 off, but it's about 8,450 to this point.
Okay. All right. And have you previously been called in court to testify as an expert in forensic pathology?
Yes, I've been called several times here, actually, in Butler County over the years.
Okay. How many times in total? Just an estimate of how many times you've been an expert in forensic pathology in courts.
Well, as far as my autopsies, I keep very detailed logs. That's why I can tell you almost exactly how many autopsies I've done. I don't specifically list every time I've testified in court, but I know prior to COVID, I averaged anywhere from 8 to 10 times a year. And obviously, from when I started to COVID, that was about 20 years. And then, obviously, there was a little bit of a downtime, and now things are starting to pick back up again. So it's over, 200 times, by now, since I first started here in Ohio.
Okay. And is that all of those times you testified as an expert, has that been in Ohio or other states too?
Well, since that time, the majority have been in Ohio, but because of the time when I was working in Dayton, we did contractual work for some of the counties in Indiana. So I've testified in Indiana. Just last week, or 2 weeks ago, I testified in Kentucky from an incident where someone was brought into Ohio. Testified in federal court in Columbus and federal court in Cincinnati. So I've had a lot of different experiences.
Okay. Your Honor, at this time I would ask that Dr. Oettinger be declared as an expert in forensic pathology.
Judge, I have no voir dire for this witness concerning his expert qualifications. There's no objection to his testifying as an expert.
Thank you. All right, the witness will be qualified as requested.
Thank you.
Thank you.
Doctor, what is an autopsy?
Well, an autopsy involves an external examination. where you look at the body and make note of any kind of identifying marks on the body, any type of medical intervention, personal property on the body. We photograph the body, make diagrams. The internal examination, which is the more lengthy of that process, involves removal of all the internal organs, looking for trauma, looking for evidence of natural disease processes like cancer, any kind of congenital abnormalities, anything that could potentially cause a sudden unexpected death. During the course of the internal examination, we obtain specimens, blood, urine if available, vitreous fluid from the eyes in order to be submitted for toxicological analysis to see if any foreign substances are in the body. And if necessary, some very small pieces of tissue obtained during the course of the autopsy can further be submitted to our histology lab so we could have some glass slides produced if there was something that we needed to look at under the microscope to make some sort of determination as to the cause of death. So it's an external exam, internal exam, toxicological analysis, and possibly histology or tissue analysis.
Okay, thank you. I want to direct your attention to October 12th of 2022. At that time, were you asked to perform an autopsy on the body of Rachelle Brewsaugh?
I was, yes.
Okay. And where was that autopsy performed at?
At the Butler County Morgue here in the city of Hamilton.
Okay. And did you take photographs? I believe you said as part of an autopsy you take photographs. But during Rachelle's autopsy, did you photograph the body in that autopsy?
Well, I personally did not take the pictures. Typically, it's either the investigator or the morgue assistant who is assisting with the autopsy is the one that actually takes the photographs under my direction. Yes.
Okay. Would those photos aid you in your testimony today?
Yes.
If I may approach the witness.
You may.
Doctor, if you would take a look, please, at exhibits 178 through 205, and just flip through them and take a look at all those and let me know when you're done looking at them. And I'm sorry, Mr. Wilder, I didn't show them to you, but it's 178 through 205 on the top.
Okay, yeah, I've got
Okay.
it on my computer, thank you.
Have you had a chance to look at all those?
Yes, it did.
Okay. And generally speaking, what are exhibits 178 through 205 photos of?
These are photos that were taken during the course of the autopsy.
Okay.
Some of them are external photographs, and some of them are a few of the internal organs.
Okay. And these are photos taken during Rachelle Brewsaugh's autopsy that you performed, correct?
Yes.
All right. And these, are they true, fair, and accurate depictions of the autopsy you performed on Rachelle's body?
Yes.
Okay. Your Honor, I would ask that State's Exhibits 178 through 205 be admitted and be allowed to publish.
Mr. Wilder?
We have a brief sidebar.
Sure. You may continue.
Did you, well, I guess you made the ruling on the
Yes,
side.
I'm
Okay, all right.
including all of the photographs except 198, for which I'm reserving ruling.
Okay, thank you.
Thank you, and you may publish them,
Okay,
those
thank you.
photographs.
All right. Doctor, before we get to the exhibits, As part of your duties, do you create a report for each autopsy you perform for the Butler County Coroner's Office?
Yes, I do.
Okay. And I guess you do that for any county you perform an autopsy in, correct?
Yes.
All right. Did you generate a report for the autopsy of Rachelle Brewsaugh?
Yes, I did.
And is that report kept in the ordinary course of business for the Butler County Coroner's Office?
Yes.
Okay. And would that report aid you in your testimony to the ladies and gentlemen of the jury here today?
Yes, it would.
Okay. May I approach the witness again? This is Mr. Wild, 206. Doctor, we give you State's Exhibit 206. Can you please take a look at that and identify Exhibit 206? And what is that exhibit?
It is a copy of the autopsy report, which I created, and there's also a copy of the toxicology report, which I personally do not generate. The specimens that are submitted are recovered during the autopsy, but obviously the testing is done by a toxicological laboratory.
Okay. It's part of your report, though, the toxicology report?
Well, it's included
Okay.
in the exhibit, and I certainly use that information when making a decision about the cause and manner of death. But I'm just clarifying that I did not generate that toxicology report.
All right. Is Exhibit 206, though, a true and accurate, fair representation of the original that you created and the toxicology report that you received to aid you in your autopsy in determining a cause and manner of death?
Yes, it is.
Okay. I would ask that State's Exhibit 206 be admitted and permission to publish it at any time if needed. I don't believe I will, but.
I have a brief summary.
Sure.
If I can approach the witness, Your Honor.
You may. Okay, so 206 will be admitted without the toxicology report.
Okay. Thank you, Your Honor. Dr. Updegrove, can you please explain to the jury the process of performing an autopsy, starting with the moment you receive the body?
Well, the external examination is what happens first, and it's a combination of writing things down, documenting things, hair color, eye color, any kind of scars or other identifying marks, whether there's any medical intervention on the body, any obvious injuries, and those things are also documented via photographs that either the investigator or the autopsy assistant may take. So once the external exam has been completed, we begin the internal exam, and as I alluded to earlier, that involves removal of the internal organs. So in a case like this, when I can clearly see that there's been multiple stab wounds on the outer surface of the body, we're looking at documenting and identifying any type of internal injuries or damage, which organs may or may not be affected from these stab wounds. In addition to that, again, we're looking for things like coronary artery disease, cancer, cirrhosis of the liver, other types of diseases that may involve other organs in the body, any obvious sign of infection. So after the organs are removed, they are weighed and dissected individually, and then after the autopsy, the majority of the tissue is then returned to the body. We retain a few small pieces, like I said earlier. In the event we need to do a microscopic examination, we have small pieces of tissue that can be submitted if that was necessary. And then after the toxicology testing is completed, then the autopsy report would be finalized. So I don't finalize a report until I've got the final toxicology report to make sure that you're not surprised by some significantly elevated drug or other substance present in the body.
Okay. And can you just take us through the physical description of Brewsaugh's body?
She was 65 inches in height, which is 5'5", and she was 232 pounds. Again, it was fairly obvious because of the number of stab wounds present on her head, her chest, her abdomen, her arms, and there was one on her leg, on her back, that she had sustained multiple stab wounds. So again, this is one of these types of cases where just during the initial external examination, it was fairly obvious to me as far as what the cause of death was going to be.
Okay. Just start showing you the photos and go through those now. We can see Exhibit 170. Doctor, obviously it's on the screen there in front of you and should be, I think it's on the screen in front of you, isn't it? Okay.
Yes.
And then on the big screen there, can you please explain to the jury what we're looking at in State's Exhibit 178?
Okay, this is a placard. Again, that's not my handwriting on there, but the people at the Butler County Coroner's Office in the morgue will write the case number, which is that 22-1012 is the case number that was assigned to this, and it has the decedent's name, and it has the date that the autopsy was performed, October 12th, 2022, and of course, Dr. Lee Manning is the coroner for Butler County.
Okay, thank you. If we could go to 179. And please describe Exhibit 179.
All right, this is something that you do in all the autopsies, basically taking a shot of the face in order for identification purposes, because some of the times when we do autopsies on people, they're not identified at the time. So it's nice to have a photograph of the person's face for potentially identification purposes. In this particular case, it also documents that there is an injury on her nose that can be visualized here.
Okay. 180, please. And tell us what we're looking at in State's Exhibit 180, please.
Okay.
Okay.
Objection.
If anyone cannot compose themselves in the courtroom, then they're going to need to leave the courtroom. Okay? Go ahead, Mr. Long.
I'm sorry, Doctor. Please describe what we're looking at in State's Exhibit 180.
All right. In this picture, it focusing predominantly on the anterior aspect of the chest and the abdomen. You can also see the left hand and the left forearm and left upper arm in this picture. But as I mentioned, there were multiple stab wounds. The vast majority of the stab wounds she sustained were in the chest and abdominal area. There were a few on the hands and arms, but predominantly chest and abdomen.
Okay. And what do you see protruding from some of the wounds?
Okay. In the right lower quadrant, there's actually the yellow is some of the abdominal fat, and then there's also a portion of the small intestine which is protruding through one of the stab wounds.
Can you just, you should be able to touch that screen and circle which ones you're talking about, I think. Wait a minute. Sorry. Now you should be able to, and what are you circling there,
That
Doctor?
is, well, the yellow part is fat, and then this little tubular here, that's the small part of the small intestine.
Okay. And then the other one above, or to the left of it?
That is a mental fat, and then there's again some fat and another little piece of intestine protruding through there.
Okay. All right. And then if you go to the top right corner of your screen, that little arrow, you can hit that and then hit clear, and it should take the...
Okay.
Thank you. States Exhibit 181, please. Doctor, what are we looking at in States Exhibit 181?
Okay, now we're looking at her from the left side, and it's some of the pictures that are taken in the course of the autopsy. Sometimes they're taken as is, received with whatever clothing, or if there's blood or dirt. Clearly in this picture here, as compared to the last one, some of that blood that was present on her chest and abdomen on the skin has been wiped away to better illustrate the size and configuration of some of these stab wounds. So again, there's multiple stab wounds on the chest and abdomen. Again, on this left side, there's intestines which are protruding through that hole there. If you look at her left hand, there's actually some small injuries on the hand, contusion on the hand. There's another superficial wound there on that forearm. So this kind of shows you the relative symmetrical involvement of the right side of the chest and abdomen and the left side of the chest and abdomen.
Okay. And the injuries on the hands and arms, do those signify anything to you?
Well, I consider those to be defensive type wounds, and I believe we will see some photographs that are more close-up showing trauma to the hands and in between the fingers, forearms, locations typically seen when an individual is trying to defend themselves during an attack like this.
Okay. And if I may, because I don't have a screen to point at, is that all right if
Sure.
I walk? Okay. Doctor, some of these wounds look darker than other ones and some look lighter. Does that signify anything to you?
Well, what can happen in cases where people have sustained a large number of stab wounds, there's a couple of different things that can happen. Number one, if you sustained a stab wound that hit a vital structure like the brainstem or a large knife that damaged, significant damage to the heart, an individual could die fairly quickly. In other cases where there's multiple stab wounds, if there's not severe enough trauma to an individual organ, it's possible that the cause of death is more from exsanguination or bleeding to death, more so from an individual organ being so damaged that it would cause an immediate death. So when there's this many stab wounds, sometimes some of the wounds as they're inflicted, and I can't put any kind of order on when these wounds were sustained, but some of the wounds have very little bleeding in the subcutaneous tissue and the fat, and that's because some of these wounds may have happened as the person is quite close to death or actually has died because the heart is no longer beating because of the amount of blood that's been lost in the circulatory system. So some of the wounds show that subcutaneous hemorrhage.
Okay. And could you just point out the difference of, like, I know we may be able to see this on some other photographs, but can you point out the difference between, like, two of the wounds?
This one here, there's very little bleeding. I mean, all you're seeing really is the yellow fat, where a lot of these other wounds, there's much more redness associated with the soft tissue.
Okay. Thank you. If you want to hit clear there. Can we go on to 182, please? And can you please describe Exhibit 182 to the jury, please?
Okay, in this particular photograph, there's a couple of things we're looking at. One, there's things that are called an acute contusion or bruise on the hand here, and then on this area where the knuckles are, there's some purple discoloration. And again, I can't say how it happened, but, some sort of blunt force, to the hand, which causes a bruise. In addition to that, there's also a couple of superficial injuries to the hand, which are more consistent with a sharp force type of situation.
Okay, thank you. Clear those out. Exhibit 183. Can you please describe Exhibit 183?
Okay, this is a closer up image, and the hand is slightly rotated for this picture. Again, showing that rather large contusion or bruise on the left at the base of that index finger. And what we're looking at here is kind of in the web in between the index finger and the thumb, and that soft tissue is a wound from sharp force injury. Again, one of the things that I mentioned earlier, as far as what I would consider a defensive type wound that could be present on the hands or the forearms during the course of an assault.
Okay, thank you. 184. And what are we looking at here in State's Exhibit 184?
All right. Again, this is showing the left hand and the left forearm. And, the thing that it's variable, when we're looking just on the chest and the abdomen, the shape and the orientation of what these stab wounds look like, they're not all the same size. Some of them are curved, some of them are more straight. So when this person is moving, that can alter what a wound looks like. Also, when you have something like this, the hand and the forearm, there's a lot less flesh, fat, other subcutaneous tissue, muscle on the hand and the arm as opposed to the chest and the abdomen. So sometimes when a knife penetrates the soft tissue, and if it hits a bone, the knife doesn't protrude as deep as it would if it was on a chest or an abdomen. So sometimes these wounds can be much more superficial just because the blade doesn't effectively penetrate as much. So these particular wounds here are, I would say, much more superficial or shallow compared to some of the wounds that we saw in the chest and abdomen. But again, they're certainly significant. These type of wounds you're not going to bleed to death from these, but it shows or indicates that this individual was alive and at the time when this assault occurred.
All right, thank you. 185. And what are we looking at here in State's Exhibit 185?
Okay, we've got, again, we're still on this left arm here, and again, on the forearm, there's this kind of a superficial penetrating wound here. Down here towards the elbow, this is very superficial. And then you can see here that there's this wound here is much larger and much deeper, and you can actually see there's this kind of white, shiny area, and that's actually one of the tendons, in the lower forearm, in the wrist area, and that is a much deeper injury than some of these other things that we've previously viewed.
Okay, thank you. 186. Oh, yeah, sorry. Is it not working?
I don't have the option to. I don't. Have
Maybe
it.
just tap up. Just try and tap up there. It might bring it up.
Okay.
Yeah.
I did. Thanks.
And this is State's Exhibit 186. Can you please explain this photo?
Yeah. So this is again with the hand being rotated or the arm being rotated, and a little bit more close in from that last image that we saw, showing that there's this much deeper, more of a gaping type of stab wound, and has transected several of the tendons in this wrist area. And that's what you can see here, and here, and here.
All right. Thank you. And if you can clear that out. 187. And what do we see here in State's Exhibit 187?
Okay, Again, in this image, we're closer in, a couple things. Number one, I think you could appreciate that there's a lot of variation in what these wounds look like. They're not all the same size. Some of them don't have very much hemorrhage. It's almost just yellow fat. This situation has some intestines protruding. Both of these wounds have subcutaneous hemorrhage associated with it. This wound here is a little unique because you can actually see that there is a sharp end, a little pointy end here, and there is a blunt end, on the other end there. So it also has very little hemorrhage associated with it. So,
Okay, all right. You want to clear that out? $188. What are we looking at in States Exhibit 188?
and we're in the same basic sort of orientation, except we're a little bit more over the body. And again, some of these, like this here, very superficial, but clearly some type of sharp force injury there and right there. Here's another one of these wounds where there is a pretty identifiable blunt end here, and there's a little bit more of a pointed, sharp end there. Again, that would be one of these wounds when compared to this one, which this one here has much more hemorrhage associated with it. But like I said, I can't put any sort of sequence on when these individual wounds were sustained.
Okay, thank you. 189. What are we looking at in States Exhibit 189?
Again, I didn't take these pictures, but again, this picture is another illustration of comparing this end. There's somewhat of a blunt end, and again, at the time I'm doing the autopsy, I don't have any idea as far as what type of sharp force implement was used. However, you can see in some of these that there is a blunt end, a one end, and a more pointed end opposite to that. And I think that's...
Hold on one second, Doctor.
Whoever's got some kind of electronic on it needs to be turned off. If another device goes off, it's going to be confiscated by the court. It's important that the jurors be able to hear the testimony. And I'd also ask that people refrain from going inside and outside of the courtroom on a regular basis. Of course, if you need to leave at some point because you can't keep your composure, you can do that, but let's try to do it quietly and not distract from the testimony. You may continue.
Okay, yeah.
I'm sorry, go ahead. Yeah, go
This
ahead.
particular wound that's adjacent to this ruler, again, it's, of course, the ruler's used for scale, just to give some sort of a dimension about the size. But again, there's a blunt end here, and a little bit more of a sharp end here. In the same view here, there's another blunt end there with more of a pointy end here. But this wound has very little to no hemorrhage associated with it compared to the one in the corner. Again, It's just sort of a compare and contrast.
In that scale there, Doctor, is that like how the two that you, or the one that has the ruler around it, like how what are the dimensions of that?
That one is about 3.5 centimeters in length.
Okay. And the width, I guess, would be how many centimeters, if you can
The
tell?
width in that one is going to be about 1.25 centimeters.
Okay.
And again, the thing about, just to explain, there's different types of elastic fibers throughout your body beneath the skin. So it depends on how, when a sharp force injury is implemented, it depends on whether or not you're cutting in parallel with these elastic fibers or more perpendicular. So theoretically, you could take the same implement, and depending on how hard or not as hard of a stab was implemented, the shape of the wound can vary significantly based on the location on the body because of these elastic fibers, which could cause a wound to potentially gape open. So that's why some of these just look very different.
And can I have 1 second? You want to hit clear on that one, Doc?
Okay.
180, or 190, I'm sorry. And what do we have here in State's Exhibit 190?
Okay, so this picture is taken from the head looking downward towards the upper chest. And again, there's multiple more hemorrhagic wounds here on the right breast. A couple of these ones over here on the left breast, not nearly as much subcutaneous hemorrhage. There's also, over on this left sort of anterior shoulder area, there's some faint bruising here with some very superficial injuries that I can't necessarily call that a stab wound, but I mean, it could be fingernail scratch, it could be an abrasion from falling and hitting something, but they're just much more minor injuries compared to what we're seeing on the chest.
Thank you. You clear that out. Let's go to 191. And what are we looking at here in State's Exhibit 191?
Okay, this is more of a close-up view of the right side of the lower abdomen, where we had seen earlier there's fat protruding through the stab wound here. This is small intestine here, there's small intestine here. And again, to show this wound here, there's more of a blunt end here and a really kind of a sharp, more pointed end on that particular wound, which there's very little hemorrhage associated with that one.
All right, thank you. 192. What are we looking at in this one?
So now this is an image of the right hand, and very similar in appearance to the left hand in that fact that there is a contusion or bruising acutely here on the right thumb. There's another bruise you can see up here on the right kind of wrist, forearm area. And like the left hand, some of these injuries on the hand are relatively superficial compared to the types of injuries that we saw on the chest and abdomen. But again, something that really is kind of a classic example of a defensive type of injury.
Thank you. You can clear that one. 193. And what do we have here in 193?
Okay, this is a picture of the right arm, very kind of a superficial type of sharp force injury, but it's also surrounded by a bruise or contusion, dark purple discoloration there. Again, that doesn't really extend just barely through the skin, so there's no significant damage beneath this wound. But again, with its anatomic location and with what we're seeing here is again consistent with another one of these defensive type of wounds.
Okay. And let's go on to the next one then.
194?
Yes. What do we have here in State's Exhibit 194?
Okay, this is again a closer up image of the face, which we previously saw in the identification picture earlier. This injury is present on the nose. It is roughly kind of a linear type of injury, but again, it does not extend very deep. It doesn't really penetrate deep into the subcutaneous tissue. So again, this wound would not have caused any major injury or trauma, but again, it's just something that's documented, and I can't say exactly how this occurred in the course of the circumstance. But also, if you look up here just at the top of the hairline, there's another one of these very superficial type of injuries. And again, this one is located literally right against the skull, and knife wouldn't have been able to really penetrate deep, so it's very superficial. Where this thing here on the nose There's a little bit more soft tissue on the nose as compared to this forehead, but because there is a little bit more tissue, I think that's why this one is a little bit more substantial in size.
Okay, thank you. 195. And what do we have here in State's Exhibit 195?
Okay, so now the photograph is now taken from the perspective of the top of the head. So this injury here in the corner where the ruler is what we just previously looked at, the injury at the top of the kind of the forehead right there at the hairline. Again, very superficial, sharp force injury. And also in this picture you can see that there's some additional injuries more on the top of the head as well.
All right, thank you. There we go. 196. Now, what do we have here in 196?
Okay, so what I did is, in order to better illustrate these, some of the hair I did shave on the top of the head from some of those images we just saw to show that, again, there are these superficial stab wounds to the top of the head. And again, because they do not penetrate through the skull, there's a very shallow depth to these things. But again, when a knife hits the bone and it's not able to fully penetrate, you can get varying sizes and different orientations in these wounds, and that's what we have here. None of these three look the same, but they're all caused by a penetrating stab.
Okay, thank you. On 197, what do we have here in State's Exhibit 197?
Okay. So as I mentioned earlier, the majority of these wounds were on the chest and abdomen. Some more superficial ones on the hands and forearms. Well, this is the only one that was present on the left upper back. And during the course of the autopsy, again, in the beginning, we're taking this picture, so the body has not been opened up, so there's still, blood inside the body, and in manipulating the body, blood can still come out of an injury, especially on the posterior aspect of the body where a person has been laying on their back and you see blood settling. Well, that's what all this purple is. This is livor mortis, where after one dies, the blood starts to settle. So because of that amount of blood in your posterior body, this purple thing here is that blood is oozing out or coming out of this stab wound. So in this particular image, you can't actually make out what the wound looks like real well because there's blood coming out of the stab wound. But that's the only one that was present on the back.
Okay. You hit clear on that. And doctor, if you want to turn in the exhibit book there to 198. Or,
This is.
Yeah, this is.
Objection to the next one, Judge, just for the record.
Doctor, looking at State's Exhibit 198, don't describe what it is yet, but would that exhibit, is that going to aid you in determining where penetration wounds are inside of the body and what organs they affected and what areas of the body they affected?
Well, what this picture shows is when we make what we call the Y-shaped incision, make an incision on the chest, down to the midline, and then down the abdomen, and then we reflect the skin, the subcutaneous fat tissue, and the muscle back to expose the chest plate so we can further remove that to examine the internal organs. And in this image, it shows where that soft tissue has been exposed, and you can see focal areas of hemorrhage on the chest and abdominal area to indicate where some of these stab wounds entered the internal part of the
Okay.
body.
And would this exhibit aid you in explaining to the jury the injuries that, even more so than what we've seen on the external photographs?
Yes.
With that, the court will overrule the objection, and the exhibit will be admitted and it may be published.
Thank you. 198. All right. I know you just explained it without the picture up there, but can you now explain it so the jury's now viewing it? So can you please explain
Right.
it again?
Okay. So I realize you're not used to seeing, these type of images, but, all this yellow that we're looking at is adipose tissue or fat. And then you have, all this, is muscle here. So in these areas where there's this dark red area, that is hemorrhage that's not normally supposed to be there. And you can actually see in this area, there's actually a hole in between where the ribs are in that intercostal space where some of these stab wounds have penetrated to involve the internal organs. And you can see some more hemorrhage over here on the right side of the chest. Again, this piece of soft tissue that is now up covering the lower part of her face, if you, pull that back down, it would be in that lower chest area, and that dark red hemorrhage there normally would not be there. So again, that is an indication anatomically of where we're looking at injuries.
Okay. So correct me if I'm wrong, but are all of the darker spots, like even lower than where you've marked, are those all hemorrhage spots?
Yes. And then there's actually, you can see some of them in the actual omentum or the fat in the intestine.
Okay. Thank you. If you want to clear that out. 199, please. And what are we looking at here in State's Exhibit 199?
This is the heart.
And what's significant about this, about the heart here?
Well, there's a few penetrating injuries from the stab wound. Again, holding the forceps here is like a big pair of tweezers, showing that there is a hole there. And there's another injury down here on the lower aspect of the right ventricle. Right there. Those are the two that you can see right there.
Okay. And would either of those alone be enough to end someone's life, or is this in connection with the other wounds?
Well,
Or if you don't know, you don't know.
well, I'll say that, the cause of death is due to multiple stab wounds.
Mm-hmm.
Probably the ones that I would least want to sustain would be ones to the heart because of the nature of the importance of living
Mm-hmm.
to have your heart beating. So, these type of injuries with blood accumulating in the pericardial sac, which would further inhibit the heart's ability to beat, and then with blood starting to go into the chest cavities through that damage of the pericardial sac. Clearly, these are serious injuries that would not be immediately lethal or immediately incapacitating lesions, but unless sustaining something like this, unless you got surgical intervention within minutes or something, having some type of rescue personnel that knew what they were doing, this is alone would be enough to kill somebody.
Okay. All right. If you want to hit clear on that. Let's go to State's Exhibit 200. And what are we looking at here in State's Exhibit 200?
Well, this is from a different inferior vantage point. Again, similarly, before took these forceps and just lifted
And
the
again,
tissue.
just this is the heart again, correct?
Yeah, this is the heart.
Okay.
So this
All
is that lower wound that I pointed to the last time that wasn't being opened up with the forceps there. It's just showing the size of it because in the prior image it was somewhat collapsed. So I'm just showing the significance of that injury there.
201. What do we have here in State's Exhibit 201?
Okay, well, on this board where we do the dissection, there's a portion of the heart which is visible there, So there's one lung over here, and then here is the other lung. And in this particular situation, each of the lungs has a penetrating stab wound. And in this lung here, and there's a hole, and you can actually, in the middle of that hole, you can see the bottom of that board there, that little white thing. So that hole goes all the way through the lung.
Okay. Is this the left or the right lung? Or-
That's the left lung.
Okay.
The left lung has 2 lobes, where the right lung has 3 lobes. That's the way you can differentiate the two.
Okay, all right. And are there injuries on the one in the upper part of the picture? I can't remember which one. Now, you
Yes.
said this is the left lung, so the right lung, where are there injuries on the right lung up there?
I believe there's a separate
Another,
photograph
okay.
that will illustrate
All right.
that.
Then we'll move on to 202, please. What are we looking at here in States Exhibit 202?
Okay. As I just mentioned, right lung, it's 3 lobes, right upper, right middle, right lower. So this is the right middle lobe, and there is another penetrating injury right there.
Okay. And what do these penetrating injuries do to the lungs, or how do they affect the lungs?
Well, it causes a couple of different issues. Number one, obviously, is bleeding. I mean, because the blood that your heart pumps, from the right ventricle, the blood's going to the lungs to get oxygen. So the lungs are very vascular organs, so there's bleeding. And then the other thing is that can happen is when you have whether a penetrating injury from a bullet or a knife, it can cause the lung to collapse, which would make breathing or respirations even more difficult. So bleeding and a potential lung collapse are issues you have to deal with.
Okay. Would you like some water?
I'm good, thank you.
Okay, all right. You want to hit clear on that, please? 203, please. Can I get 1 second here?
Yes.
Sorry. What are we looking at here, Doctor, in States Exhibit 203?
Okay, this is a picture of the liver. So the liver, typically by weight, is the largest organ in the body. And the right lobe of the liver, which is larger, is located more on the right side of the midline, and then it sort of tapers down. Then your left lobe is a little bit smaller. So this image, this is the larger right lobe over here, and then this left lobe over here, there is a penetrating injury right there.
Okay, and what do those types of injuries do to the liver?
Well, again, the liver is another one of these organs that's very vascular. So all the blood from your lower body, as it's returning through the inferior vena cava to travel back to the heart to get oxygen, there's a lot of blood vessels, and damage to the liver is certainly going to cause hemorrhage. So again, I mean, it's singularly, a wound like this could cause someone's demise if they didn't get medical treatment very rapidly. But you would probably have a greater survivability if this was the only one you received versus the stab wound to the heart or to the lungs.
Okay.
But again, a very serious injury nonetheless.
Okay. You want to hit clear on that? 204. And what do we have here in States Exhibit 204?
Again, this is the right lobe of the liver. It's much larger, and there's a much larger kind of gaping wound here, and then a little smaller one there. There's another one down here. And as you saw from the number of these wounds that were involved on the chest and abdominal area, and with the liver being as large of an organ as it is, it really wasn't a surprise that the liver had a lot more injuries as compared to the heart or the lungs.
Okay. All right. And let's hit clear. Let's go to the next one. And 205, please. And what are we looking at here in State's Exhibit 205?
All right, so to explain how we examine the head and examine the brain, what we have to do is make an incision starting behind the ear, go up over the crown of the scalp, back behind the other ear, and then with a scalpel, loosen up the underneath tissue of the scalp and push the scalp forward and then pull the scalp backward to expose the calvarium, which is the big round part of the skull. So in this picture, if you could imagine, her chin would be down here. So this scalp has been pulled forward, covering her face. So when I showed you those pictures before, there was a wound on the forehead area and then 3 other small stab wounds kind of on the top of the scalp. What you can see here is there are these hemorrhagic areas in the soft tissue of the scalp which correspond to where the stab wounds were sustained. And right here, you can see that there is a little defect in the outer table of the skull, or the external part of the skull. There's a little bit of that bone is chipped away, and this is in proximity to where this damage here is on the scalp. If you pull the scalp back, so this is going to be overlying that. So as I mentioned earlier, once I did the subsequent removal of this calvarium, exposed the brain, there was no penetrating injury to the brain or any significant brain hemorrhage. Again, it's not an easy thing to do, to be able to stab an individual and make the knife go all the way through the skull. But this is just documenting that this was forceful enough that it did cause the outer part of the skull to have this defect in it.
All right, thank you. Doctor, what is a blood card?
A blood card is something that is routinely done at the time of autopsy, where we'll take part of the decedent's blood and put it on this card, which can be retained for DNA analysis if it was to correlate to a crime scene, if it had to do with the paternity issue, for males, obviously, that were warned about paternity. So it has multiple uses, but it's a way that subsequent studies can be done long after the person has been buried.
Okay. And did you create a blood card for Rachelle Brewsaugh?
That is something I don't personally do.
Or was one created for her?
As far as I know, yes.
Okay. All right. And then those blood cards are, do you know, if you know, did the Hamilton Police Department take that blood card?
I honestly don't know.
Okay.
How after it was created, I didn't know what happened to it since then.
Okay, but that's also so that's used to determine someone's DNA.
Yes, it can be. Yes.
Okay. All right. Thank you. And after performing the autopsy on Ms. Brewsaugh, were you able to determine a manner and a cause of death?
Yes.
And can you please explain to the jury what the difference between the two is?
Yeah. All right. The cause of death, there's a myriad of things that can be cause of death. And in today's world of forensic pathology, the most common thing we deal with now are drug overdoses, so fentanyl intoxication, multiple drug intoxication, traffic accidents, blunt force injury of the head or blunt force injury of the chest, gunshot wounds, stab wounds, drowning, electrocution, Sometimes we'll do an autopsy on someone and it end up being a natural cause. Someone didn't know they had heart disease, or they had an undiagnosed cancer, things of that nature. So that's what the cause of death is, whether it's something natural or unnatural, which leads into the discussion about manner of death. So manner of death on the death certificate, there are 5 options. You have to check one of these boxes. So it's either homicide, suicide, accident, natural, or could not be determined. That the could not be determined is when you have an apparently healthy 25-year-old person, and then after the autopsy there's no obvious grossly identifiable cause of death. You do toxicology testing, that's negative. You look at slides under the microscope and you can't identify anything. So in those kind of cases, maybe it's a congenital heart arrhythmia that we can't identify at autopsy, or maybe it's some substance that was taken that the toxicology labs aren't able to identify yet. So we don't have many of those undetermined cases. So most of them, we're pretty good at being able to make a definitive ruling on a manner.
All right. And doctor, using your education and training and years of experience, were you able to come to an opinion, or to a reasonable degree of medical certainty, to an opinion of the cause of death and manner of death of Rachelle Brewsaugh?
Yes, I was.
And what was your opinion as to the cause of death?
Multiple stab wounds.
And what was your opinion to the manner of death?
Well, just to clarify, I mean,
Okay.
my opinion that the manner of death is a homicide.
Mm-hmm.
Now, I don't actually sign the death certificate because Dr. Mannix, who's the elected coroner of Butler County, she's the one that signs the death certificate.
Okay.
But I mean, I certainly would classify this as a homicide, yes.
All right, thank you. All right, 1 second. Doctor, I do have one other question. When you performed this autopsy, can you tell a jury about the internal bleeding you saw, and was there a lot of blood in her body or not in her body, or
Right.
can you explain that, please?
Yeah, well, you know, what I attempt to do is when we have anything where there's some kind of blunt force injury, attempt to measure any quantifiable blood volume that's in the different cavities of the body. And in this particular case, there was, and I say approximately 900 milliliters of blood, or almost a liter. 1,000 milliliters is a liter. So almost a liter of blood in the right chest cavity, 700 milliliters in the left chest cavity, and then another 100 in the pericardial sac, which is the sac that surrounds the heart. So just adding that up, that was 1,700 milliliters, or 1.7 liters of blood that I was able to recover from the cavities. Now, obviously, there's still blood in her body, as you could see from that picture. We had her rolled over on her side to show her back. There's still blood that's coming out of some of these injuries. So I can't say how much blood was still in her soft tissues and muscle, but at least I was able to document how much was present in her internal cavities.
Okay, and just how much blood is in a person's body as you sit here today, or roughly?
I mean, it's going to vary based on the size of the person, whether they're well hydrated or not. I mean, you're talking about, possibly 4 to 5 liters of blood.
Okay, all right. Thank you. I think that's all I have. Thank you,
All
Doctor.
right, thank you. Cross-examination.
Good morning, Doctor.
Good morning.
I want to talk to you first about during your testimony, you referred to stab wounds throughout. And if I could, have the state pull up Exhibit 187 so I can talk to the doctor about that. Doctor, are you able to see State's Exhibit 187?
Yes, I can see it.
And I want to talk to you a minute about when you say stab wounds. Now, what's the difference between a stab wound and a cut, a nick, a scrape? Why do we use the word stab wound during your testimony?
Well, typically, you're right, there are different terminology. A stab wound is typically a wound that's deeper than it is on the surface, where an incised wound, where someone has had their throat cut, where the wound is longer on the surface than it is deep. And then the term you used, a cut, I mean, a cut could be, it could be a paper cut, very superficial on your finger, or a cut could be more of an incised wound, something that's very superficial on the surface.
Okay. Well, the reason I ask, if, for instance, if I'm working in my garage with a cutting knife, cutting up cardboard, and I slice my finger, I don't walk in and go, I just stabbed my finger. Stab seems to connote that you know exactly what caused these injuries and how they were. Is that what you're trying to tell us today, that you know exactly how all this occurred and what caused these injuries?
Well, the majority of the injuries are stab wounds because they're deeper penetrating injury than a more superficial incised wound, or even if you were in your garage and you cut your finger, that would be more of an incision. If you think of the term like surgical incision.
Okay.
So there are some of these things on her body, which I alluded to earlier, that they were so superficial, whether it was something that occurred and a couple contusions that could be associated with a fall or just some sort of glancing injury. But I mean, I've done enough autopsies on people that had sustained multiple stab wounds, and I'm familiar with what the variable appearances that some of these stab wounds may have, even if the same implement was used.
Some of these you described as superficial. Were you including those as one of the 55 stab wounds you noted in your report?
Some of them, no.
Give us an idea on 187, and I'm talking about, obviously we can tell some of the bigger cuts here, but some of these smaller portions of her body, which you consider a stab wound, some of the smaller ones.
You want me to start pointing out stab wounds?
Yes.
It might be easier for me to point out the ones that aren't stab wounds. So all these things that I've put these little dots are clearly stab wounds. Something that would be more of a superficial scratch, scrape, incised wound would be something like that, something like that, something right there. I mean, so in this picture, I mean, the majority of these things are stab wounds. There's a few that, like I said, an incised wound typically is something that's longer on the surface than it is deep, that I wouldn't classify as a penetrating stab wound. So there's a few in this particular image that I did not count as a stab wound.
Okay. And I guess I also want to talk to you, when we hear, it's common when we hear the word stab, we think of things going directly into the body. Are you describing these stabs as you're saying that something went straight into the body or just may have nicked or scraped the body?
Well, I'm not saying that they necessarily went in straight. Again, a couple different factors why these things can look so different. Number one, if the individual is moving, when you're trying to hit a moving target, they're not always going to be the same. Depending on whether you hit bone beneath the soft tissue, that may impede how deep the knife can penetrate the body. Clearly, some of these wounds were able to travel between the ribs and penetrate deep enough to hit the lung, hit the liver, hit the heart, hit the intestine, where some of the other ones were much more superficial, so it basically only penetrated the skin and got into the fat. So there's a varying assortment of wounds on the body.
You kind of got into the next area I want to talk to you about movement. These injuries that we see here, some of these cuts, these wounds could have been in the process of while this person was moving, correct?
It's certainly possible. I believe, I mean, in my personal opinion, because there's not one immediately lethal injury, it's certainly possible that there was an interval where this person is moving, and because of so many of the different orientations. I mean, many times if an individual is stabbed and they're not moving, I mean, there's a very more of an organized orientation of wounds, and in this particular case, they're really not that organized in that respect. So it's consistent with some movement during the event.
Okay. And you would agree with me that, I mean, you weren't at the scene, you don't have a video to see exactly what happened, but movement could not only be someone trying to get away from someone stabbing them, correct? They could be moving away from the person who's trying to stab them.
Absolutely, yes.
It also could be that the person who has a stab wound is approaching the person who may have a knife, and there may be some sort of physical altercation going on between the two of them.
Yeah, I wasn't there, but I mean, certainly that's a possibility.
Right. At the end of the day, you don't know what physical altercation, if any, preceded or occurred during any of these cuts and these wounds.
That's correct.
You talked about liters of blood, and obviously, a bigger person has more blood. What's like I think you said Rachelle was 230 pounds. Do you have, based on your experience, your background, your training, approximately how much blood she would have as a 230-pound female?
Well, I mean, it's hard for me to, kind of in general, I think I previously stated, 4 to 5 liters, for a full-grown adult. But obviously, someone who's 7 feet tall versus someone who's 5 feet tall, and then depending on their body habitus, some could have more, some could have less. Like I stated earlier, I measured what I could that was in the body cavities. But one of the things that you look at when someone has had a significant blood loss, we look at the kidneys, because there's a phenomenon called shock kidney. Because what your body does is, in an attempt to, when you're actively hemorrhaging, you start shunting blood from your lower extremities and your lower half of your body to try to keep blood going to your brain, try to keep blood going to your lungs so you can continue to try to oxygenate. And in some of those cases, people's kidneys can be really, really pale when they've literally exsanguinated to death. In this particular situation, her kidneys were not really pale like you would see in a shock kidney. So she did lose a lot of blood, but I think it's undeniable that because of where her injuries were, it affected the ability of her heart to adequately pump. Blood was starting to accumulate in the pericardial sac surrounding her heart, and she's going to potentially have collapsed lungs because of the damage to the lungs. So although she does have a lot of internal hemorrhage, I didn't sort of rubber stamp this and say that, call it an exsanguination, because of the loss of the functional ability of her to adequately breathe and then perfuse her tissues because of the damage to her heart.
Does a 230-pound woman have the same amount of blood as a 130-pound woman? Let me ask it that way.
I would say that the larger woman would most likely have more blood than the smaller woman.
And I myself, 40 pounds heavier than the person in this, would you guess that I may have more blood than the Rachelle?
Probably, yeah.
Okay. If the state could pull up Exhibit 33, please. It's already been exhibited. 33. Doctor, I'm showing you where Rachelle was found in the home. This is the crime scene. Based on the amount of blood that would have been in her body and all the injuries that you've shown to us, including something on the wrist where it was so deep that it went down into her tendon, does it surprise you that we don't see more blood in this picture?
Well, honestly, I would expect to possibly see more blood than what I'm seeing here. I mean, obviously, there's blood on that cardboard box, there's blood on the floor, blood on the rug. There's some degree of blood on her clothing. Of course, it's a dark shirt, and she's wearing kind of darker pants. But, I mean, sometimes in these cases, there are sometimes a large, like, coagulated pool of blood, and I don't see that in this particular case.
Right, and particularly with around her wrist, we were shown a picture where you said the white part of that was basically so deep we're looking at tendon. We see both of her wrists in this picture. Would you expect, based off the injury you see later on, that there would be more blood near her wrist here?
Well, the thing that I can't answer is, and I alluded to it earlier, I can't tell you the sequence of the injuries that she sustained. Clearly, I think that one was an antemortem wound, meaning that she was still alive because of the relative amount of soft tissue hemorrhage that was present in the wrist. But I don't know if that's one of the wounds that happened, later in the assault, once her blood pressure had been significantly diminished. I mean, there is more blood on the adjacent on the floor by the left as opposed to the right, but again, not a huge pool.
Okay. You can go ahead and clear the picture off, please. When, I think you talked about this a little bit, but all the pictures that you testified about today, her body appeared to be, when I say clean, it doesn't, let me start and rephrase this. When her body was presented to you, was the skin that was untouched by any wounds, was it just covered in blood and smeared with dried blood?
I mean, not a tremendous amount, but it's one of I think probably the first picture that showed her chest and abdomen. That was one of the unclean pictures because there was, dry blood there. And then the subsequent picture that showed, I believe, the left half of her body, you could tell a difference because that one had been cleaned, but it wasn't like her body was just completely covered in blood.
Okay. Did you yourself do any cleaning of the body in order to examine the wounds?
I don't do the cleaning of the body.
Were you made aware of how much blood was on her body that needed to be washed away in order for you to do your autopsy?
Well, I saw her before that occurred, but I didn't actually clean her body myself, but I saw the condition that she was in on those initial photographs that were taken.
Okay. Next, I want to talk to you. You used the word during your direct examination. You referred to defensive wounds. When you do your autopsy, is there anyone from law enforcement that's present when you're doing that autopsy?
Sometimes there are.
Do you recall someone from this examination of Rachelle, there was someone present?
Honestly, I can't remember on that. I mean, it's been almost 2 years ago. I can't remember just who was there or who wasn't there.
Is that something you would note in your report if someone was present from law enforcement?
Not necessarily, because, there have been other occasions where sometimes a police officer will walk in halfway through a case or, stay for 10 minutes and leave. So it's one of those things that I don't, include that person in my report. I believe there is a log there at the Butler County morgue for people to sign in when they come there. But so you have to refer to that because I didn't obviously include anybody's attendance in my report.
Right. And I know a lot's happened for you in the last 2 years. I know you're through Did you get any information on this case? Does anybody provide you, hey, this woman's coming in, may have been stabbed? Did you have any information about the background of this case or the investigation?
Well, basically, when I was called to come to perform this autopsy, I was told that we have an individual who's sustained multiple stab wounds, and it was being investigated as a homicide. So that was basically what I was told.
Okay. But you don't get any information about who may have done it or how she's found or anything like that, are you?
Well, I mean, they typically, they're not telling me who did it unless it was witnessed by other people or someone has admitted to doing it. I mean, obviously, the police have to do their investigation, and they've got suspects or whatever. But at the time I did the autopsy, I did not know that there had been any definitive determination as to who the perpetrator was.
Okay. You described some, we're going to keep talking about this defensive word that you use with regards to the hands, but you could also get under someone's fingernails and maybe find their DNA or their cells to suggest someone was clawing at someone who may be trying to stab them. Could you not do that?
Potentially, yes.
And that would maybe indicate something was defensive. Is that fair?
Yes.
All right. If the state could please pull up 182. You said that this is her left hand. I know we have pictures of both her hands, and correct me if I'm wrong, but I think when you described anything as defensive, you're referring to her hands. Is that fair?
Well, hands and the arms, yes.
Okay. Well, let's talk about the hands. You described this as being caused by blunt force. Blunt force contusion to the hand could be caused by striking something with your hand. Is that fair?
Yes.
If I were to punch this podium right now, I could cause a contusion to my own hand.
Yes.
And we wouldn't know whether or not if that was truly defensive or if that was offensive. Is that fair?
Yes.
Hitting your hand on a piece of furniture could also cause a contusion. Is that fair?
Yes.
If you're struggling with someone and you fall to the ground or your hand hits something hard, that could cause a contusion on your hand as well, correct?
Yes.
Also, with some of these wounds, these stabs, these cuts, these scrapes, if a person were to have a small pocket knife in their hand and maybe using it themselves, is it possible that they could cut themselves?
Well, the location of where some of these wounds are in their orientation, I would find that kind of hard to believe that these were, what, you're saying self-inflicted wounds?
I didn't say self-inflicted. Let me ask it this way. Hypothetically, you and I are in an argument and I have a small pocket knife in my hand, and I may try to move it towards you, and in the process I miss you. I could cut my hand on my own in that scenario, can I not?
I guess that's a possibility.
All right. Because you described a lot of these wounds, these cuts, these scrapes as all different shapes and sizes, and there's movement going on. So at the end of the day, you can't sit here and tell us that we know exactly how these wounds were made. You can't do that, right?
That's correct.
You can't tell us exactly what instrument or object caused these, correct?
That's correct.
And you cannot tell us what was going on with before, during, and after these wounds are being applied to this person, correct?
Yes.
And you can't tell us if there's two people involved, whether one person or the other inflicted them.
That's correct.
Were you ever provided a photograph of knives collected at the scene for comparison with these wounds?
I have seen a picture of a knife that I wasn't told that it was definitively the knife, but something that was recovered.
So you actually had the knife, or you just had a photo of it?
I've just seen a picture.
You've seen a picture of the knife, and then did you go back and look at your photos and look at your report to compare and contrast?
Well, when I saw the image of this potential knife, what was potentially consistent is the fact it wasn't a very big knife. I mean, if you take a 6-inch, 8-inch butcher knife, typically like you'd see in the wood block in the kitchen, you don't see these kind of small wounds. You see these very deep wounds that create these gaping type of injuries in the liver, in the lung, in the heart. Based on the number of stab wounds and the relative few number of them that actually penetrated an organ, it's consistent that it's a smaller knife than a very huge, long-bladed knife. But again, you could take the same knife and get varying kinds of injuries depending on whether you full contact or a glancing blow or came in at a different angle. So I can't look at a picture of a smaller knife and say, well, that clearly caused this, or that it clearly didn't cause it. It's just it's more consistent that it was a smaller knife than a very big, long blade knife.
You did testify that some of the injuries in this case went so deep as to puncture heart, lungs, and liver, correct?
Yes.
Are you able to, it's on the outside of the skin down to the liver with a
Well, the liver is probably the easiest of those three organs that you mentioned, because anatomically, the liver is kind of just beneath the right side of that costal margin, the rib cage, and it can extend downward below that. So you might not even have to go through.
Your Honor, I believe that's been previously admitted.
It has.
What did you do with State's Exhibit 217, which is the brighter green shirt that was taken from the defendant on October 11, 2022?
So this is State's Exhibit 217. It was recovered from the defendant, as you saw in the photograph of him previously during my testimony that he was wearing. Collected as evidence. And it was submitted to BCI for further examination and DNA analysis.
Did you do a swab of State's Exhibit 217?
I did not do a swab. I submitted the entire shirt.
Okay. And did you have an opportunity to examine what I would call a Swiss Army knife or a utility type knife?
Yes, I did.
Okay. Let me approach, Your Honor. I believe previously admitted State's Exhibit 215.
Yes.
State's Exhibit 215.
State's Exhibit 215 is a red-colored, in general terms, Swiss Army knife. It's a multi-tool pocket knife, of which I was present for its discovery and recovery.
That was recovered from 1270 Parish Avenue?
It was.
Okay. And then did you have an opportunity to photograph that particular knife?
Yes, I did.
Okay. If I may approach, Your Honor.
Okay.
So you can put that back in the box here. I'm going to have you look at 147 through 157. And generally speaking, what are we looking at there in States Exhibit 147 through 157?
So States Exhibit 147 through 157 are close-up photographs that I took on a macroscopic level of the Swiss Army knife, if you would, and the two blade attachments that were within the knife.
All those photographs, do they truly, fairly, and accurately depict what the knife looked like as you were examining it?
Yes, sir.
Okay. Your Honor, I would ask that 147 through 157 be admitted and permission to publish.
Any objection?
No objection.
Okay, they'll be admitted and they may be published.
And what are we looking at here in States Exhibit 147? And again, you could either point on the screen, you can circle, or if you'd like to stand up and point, whatever is easiest for you, obviously with the court's permission.
Certainly.
No, States Exhibit 147, as depicted in the photo above, is just the Swiss Army knife, and in the condition it was found, folded, all attachments folded within itself.
148, please.
148, same knife, but one blade attachment has been retracted, and you can see it there on the right side of the photograph.
And then 149, please.
And 149 is the second blade attachment that has been retracted and is on the left half of the photograph.
And 150, please.
So 150 is the smaller blade attachment, if you would. It's about 1.5 inches in length. It has a distinct appearance because it appears initially that it looks as if it was a can opener attachment, because there appears to be that kind of design and appearance. Furthermore, on this photograph particularly, you can see what appears to be some type of residue on the knife, as if it had been washed or rinsed in some manner.
Do we know, is that blade, was it made that way, or is that a chunk that's missing out of it?
Yeah, so I gave that description because that's what it initially appears to look like. However, when you look up the actual manufacture of this knife, this blade is defected. This is actually a piece of the blade that is missing. It's not a can opener attachment. And you can see that more closely when you start to examine, as you can see, if it works with my glove or not. As you can see around the grooves within the blade, they're not smooth, they are rigid, they're jagged, and you can kind of see that there has been something that has caused this blade to be broken in some manner.
Thank you, Detective. States Exhibit 151.
So this is the opposite side of the same blade, and you can see more clearly where the piece that's missing from the blade has been broken off.
And what other visual observations were you able to make about States Exhibit 151?
Again, that this other side of the blade were washed.
And what are you seeing as indicating that to you?
As you can see, appears to be some type of residue that gives the appearance of water residue. I don't know if it's specifically water residue, but some type of solution or liquid that has left behind a residue on both sides of this blade attachment.
And 153, I'm sorry, 152, please.
This is the second blade attachment, the longer blade attachment of the same knife. As photographed, as you can see, it appears to be intact, not missing any pieces, and there doesn't appear to be any initial signs of rinsing or washing of this blade.
153, please.
On this side of the same blade attachment, again, intact, not defected. You can see that there might be some residue of rinsing or washing on this side of the blade.
154.
So 154 is the defected blade attachment, the first one, the shorter one that's about inch and a half in length. I applied an alternate light source. It's a blue light, if you would, at about 450 nanometers in length. I then photographed it using an orange lens because I wanted to see if there was any type of fluorescent reaction on the blade that might give me any type of evidence being on the blades. And after this photograph, you can see more readily that everything that's fluorescing here appears to be from some type of rinse or wash of the blade.
And what sort of light are you using?
It's an alternate light source. In general terms, it is a blue light, a forensic blue light that can fluoresce hairs, fibers. It will show the appearance of blood, but the blood will turn up darker if exposed to the alternate light source. But in order to view this type of evidence, you have to use an orange filter. And in this case, I applied an orange lens to my camera and captured the photograph.
Your Honor, if I may, can I go up and access the exhibits?
Sure.
Yeah.
And what are we looking at in 155?
155 is the opposite side of the same blade attachment, the defected blade attachment. Again, with the application of an alternate light source, blue light source, with an orange lens in place to view the results.
And what are we seeing on that blade?
We're seeing, again, you have a fluorescent reaction of where there appears to be some type of rinse or wash of the blade in some manner, as indicated by the fluorescence observed.
And State's Exhibit 156.
56 is the longer second blade attachment that is intact. Again, with the application of a blue forensic light, 450 nanometers, as viewed through an orange lens. And you can see that there doesn't appear to be, on this side of the blade, any apparent indications of it having been washed or rinsed.
And 157.
157, same blade attachment, opposite side, same application of the blue light source at the same wavelength as viewed through the orange lens and captured by this photograph. Again, there doesn't appear to be any observation on the other side of this blade of any rinsing or washing.
Is that right if I return?
Sure.
All right, so State's Exhibit 215, the Swiss Army knife, did you attempt to swab that in any way?
No.
Okay. And why didn't you?
This is what I would consider a critical piece of evidence. And sometimes when we take swabs of an item, we can interfere with the more intricate analysis of DNA examinations conducted by the State Crime Lab. Having known this to be a critical piece of evidence, I packaged the knife as securely and sterilely as possible and submitted the entire knife to BCI for them to swab in a more sterile environment to be able to yield the best results.
Okay. If I may approach the witness.
You may.
State's Exhibit 213.
State's Exhibit 213. You wanting me to explain what it is?
Yes, please.
State's Exhibit 213 is another pocket knife that was located in the residence, of which I was present for its discovery and recovery. This one specifically was recovered from the top of what I refer to as a china cabinet that had been positioned atop. So somebody had placed it up top there, but we had found the china cabinet had fallen over or placed in some manner, and this was still within that location.
Okay. And did you do any testing on that particular knife?
I did. I did the same process as the Swiss Army knife by photographing it up close, both in its natural state. It has two attachments. One looks more like a cleaver, and one, which folds in the same manner, it's not in the opposite manner like the Swiss Army knife, appears more like a traditional blade. I photographed this in their natural state, and with the application of the blue light source, at 450 nanometers and viewed through an orange lens.
Okay. And did you make any observations or findings?
This knife, to me, appeared to have been free of any type of disruption.
Okay. But nonetheless, both the Swiss Army knife and the knife that you have in your hand, those both were ultimately sent up to BCI for testing, is that correct?
Yes, sir, they were.
Okay. I'll have you go ahead and put that back in there. Thank you.
And again, I did not take any swabs from that knife. The knife itself was packaged and sent up to BCI.
Okay. I believe what's been previously admitted is State's Exhibit 211, if I may push it over.
You may.
Detective, what are we looking at here in State's Exhibit 211?
Sorry to interrupt, but 211 I had as being identified but not admitted. Are you going to offer that for admission at this time?
Yes, please.
Okay. Any objection to that?
No.
Okay, that'll be admitted.
I apologize, I thought we had shown that to the jury. so-
I think we did show it, but I don't think we officially admitted it.
You want me to stand up and show them?
Yes. Again, what are we looking at here in State's Exhibit 211, please, sir?
I have to apologize. Some of these identifiers over time have just fallen off that I placed. 211 is, for the record, what we identified as a green jacket, but it is more of a vest style jacket.
Okay. That's what was found in the basement of 1270 Parish Avenue?
Yes, it was.
Okay. And thank you, sir. And then, I believe your exhibit book is already up there on your desk. So I'm going to ask you to look at State's Exhibits 110 through 137.
.110 through 137.
Yes, sir. And generally speaking, what are State's Exhibits 110 through 137?
States Exhibit 110 through 137 are photographs that I collected of the same green vest-style jacket that I presented before you, indicating areas where I believed additional evidence was located on the jacket itself.
Okay. Are those true, fair, and accurate depictions of the green vest in those photographs that you took?
Yes, they are.
Your Honor, I'd ask that 110 through 137 be admitted and permission to publish.
Any objection? No. They'll be admitted and they may be published.
All right, so generally speaking, what sort of observations are you making about this particular green vest?
One of the options I made, in particular, was that, as you can see on the front, beneath the left center pocket on the chest, one observation is there appears to be some sort of defect or cut in the fabric, if you would. But also, when examining this closer, as you'll see in further exhibits 110 through 37, is there are a series of red stains that are present on the front side of this jacket. I have marked 3 for your vision, but there are actually 5, which you'll see in more detail.
All right, thank you, Detective. State's Exhibit 111, please.
This is the back side of the same green style vest. Just as a general observation, I kind of observed what appeared to be marks on the back side of the vest. But more specifically, what drew my attention was over here, underneath what would be the left armpit, is when you see in a further state's exhibit through this same series, there is a dry, flaky red substance that I was able to collect.
112.
This is a close-up version of what I thought may have been some type of markings on the back side of that green style vest.
113.
This is a continuation of the back side of that vest, of just the markings.
114.
So 114 is the front of that same green vest, and I have noted with the arrows, as you can see, there are 5 larger red stains that were apparent with my unaided eye on the front of the vest.
Okay. 115.
And this is the back side of the same vest, where underneath that left armpit I previously indicated, as observed in this state's exhibit, where I collected further evidence.
116.
This is just showing a little bit more closely what I am identifying through the arrows, numbered 1 through 5. You can see red stainings. We'll get to those up there that were observed on the front side of that green jacket.
117.
This is just another picture of the front of that same vest jacket. You can see marker number 2 and marker number 4 in more detail than compared to State's Exhibit 116.
118.
And again, this is just going up the front of the vest. You can see on the center pocket there on the left side of the chest, number 3, there's some red staining that is apparent there.
119.
This is the back side of the green vest, marker number 6, where I indicated I collected the dry, flaky red substance from the back side of that vest.
120.
This is a close-up photograph of marker number 1, red staining on the green style vest.
121.
Just another close-up. As you can see, there's discoloration there. It's a red stain.
122.
This is a close-up photograph of 2 things. I am identifying the red stain by marker number 2 that is surrounding the cut or tear in the fabric of that green vest.
123.
It's a close-up photograph kind of showing you a little bit more of the red staining over that same cut as identified as marker number 2 in this exhibit.
124.
Just a close-up photograph of the chest pocket and the staining that I observed over the zipper and the pocket itself.
125.
More closely, close-up photograph of what my observation was.
126.
Marker number 4, it is, if you're facing it, to the left of number 2. Again, discoloration, red staining on that green vest.
127.
Close-up photograph of identifier number 4, same clothing.
And 128.
This is identifier number 5, again, of some of the red staining that I observed on the right side of the same clothing item.
129.
An additional close-up photograph of the same identifier.
And 130.
This is the back side of that green vest, identifier number 6 in this exhibit. You can see there is what I am trying to identify.
131.
And that is a close-up photograph of the red stain. It was dry, flaky. I was able to collect it by scraping it from that jacket with a sterile scalpel.
132. Actually, let me take you back. Let me take you back to 131.
Sure.
So at some point, I assume that you collected some samples from this particular vest, didn't you?
Yes, I did.
Okay. And if I can approach the witness, Your Honor.
You may. But I would just caution you that we are running out of time, so I'm not sure when a good time to break is, but we're going to have to recess for the afternoon.
Okay. Would you like us to approach?
Yes, let's do that. Appears that now we are a good time for us to recess, ladies and gentlemen. So we're going to go ahead and do that, and we will have the same schedule tomorrow. We'll come in at 9, work through noon, and then you'll be released for the afternoon. And please remember my recess instructions. Okay?
May
See.
may we approach?
Oh, sure.
Yeah, I'm sorry.
Just a minute. Before we recess, it appears that we are getting a little bit behind, and there has been a suggestion that we would come in at 8:30 tomorrow. Is everybody able to do that, or is that too inconvenient for everyone? I hate to put anybody on the spot, but if there's anybody that can't come in or does not want to come in at 8:30, since I told you 9, can I see a hand? Okay, I don't see any hands, so let's do 8:30 instead of 9 so we can keep on track with our trial, okay? So thank you for your consideration with that, and I'll see you at 8:30 tomorrow morning.
Yeah.
The system's rigged, man, it's time to break free. Eyes wide open, gotta see what I see. Standing on the front lines, fighting for the truth. Lift the veil of lies, it's time to be the proof. Take a stand, don't you back down. Raise your voice, let's shake the town. We're the voices that won't be ignored. Breaking chains, yeah, we're ready for war. With the power of the people, we'll make them see a world of justice, united and free. United and free. United and free. Marching with a purpose, we're taking it higher. Fighting through the struggle, igniting the fire. No more silence, we'll make the noise loud. Together in this battle, standing strong and proud. Injustice fades when courage aligns. Rise up together, break the confines. We're the voices that won't be ignored. Breaking chains, yeah, we're ready for war. With the power of the people, we'll make them see a world of justice, united and free. United and free. United time to shine. Together we'll write a new paradigm. You paradigm, you paradigm. Whoa, whoa. We're the voices that